The coronavirus is the biggest threat this country has faced for decades, and this country is not alone.
Let's do our due diligence, take the precautions we need to take care of ourselves.
No matter what, I still love my job, and I'm going to do everything in my power to save lives.
कल की बात पुरानी नए दौर में लिखेंगे मिलकर नई कहानी.
Dr. Hemant Thacker, an eminent physician who is now a famous cardiologist, currently working in Breach Candy Hospital in Mumbai. He has been awarded a gold medal in pharmacology and has been practicing for over 42 years. And now he's an important member of Maharashtra's COVID-19 task force.
So it was the last week of March when everything started breaking loose. And everybody realized that this is something that we don't know anything about. This is a new disease. For me, though I have trained and I've been in practice for more than 35 years, we haven't seen something like this before in the form of crisis, pandemic, fear, wearing PPEs and seeing patients. So it was a new experience. People over 60 should certainly not come. But I decided that I'm a doctor. I have to put my best foot forward. My patients need me. My experience, if I don't knit into clinical practice and distribute it to my patients, when will I ever do that? And it's something new. We're all learning. We're thinking on our feet. The disease at that time was less than a month old in our side of the world, and maybe in China, 3-4 months old. So I went in, started wearing the PPE. To get to wear a PPE is like wearing a corset for a marriage outfit. How difficult it was, how tricky it was, how scary it was. At first, we didn't realize in the end of March or early April, when it was like April Fool, is this for real? Is this going to be something that we really need to be so careful about? You wear a gown and then you wear another gown and then you wear a mask and a second mask and a face shield. Do we really need all that? But we went along. China had taught us that it's quite severe. We kept reading cases, and it was only when things started snowballing in the first or second week of April, when our hospitals started getting filled up, when the beeline for beds came up, when in the background and in the foreground of television we saw Italy battling, Spain battling. Italy was telling us they had to choose between patient A and patient B for ventilators.
Yes.
Where the young ones were to be looked at, the old ones, they looked the other way. That's when we realized that this is serious. But by then, we had gotten rooms converted into double rooms. So it was makeshift, but the treatment did not get diluted. Only the room got divided. So I had an elderly gentleman who was admitted. He was 84. And the next day in his room, a young man of 44 got in. And I was treating both the patients. And the young man did not do well on the first 3-4 days of admission. The old man was also not well, but the young man was panicking more. So every time I went to see them, they could never see my face. My expression was invisible because we are wearing the PPE. We look like ghosts, pantomimes, fancy dress, whatever you call. But they had vision on, so they knew what was happening all over the world. And after I finished seeing the young man as I was leaving, the old man called out to me and said, "Sir, I see on television that there is a clamor for ventilators. I see that drugs are not available." He was a Gujarati. He said, "Sahib, કંઈ પણ જરૂર પડે તો પેલા માણસને પહેલા આપજો. મારી તો ઉંમર થઈ ગઈ, મારી ઇનિંગ્સ થઈ ગઈ, પણ એને જિંદગી જીવાની છે." That really touched me. And I felt that no, we have to work full blast. And I'm happy to tell you both patients went home. the young man and the old one. And I understand from follow-up that they've become best of friends. The young man calls the old man a father. So, COVID times knits new relationships. And for me, the joy on my face, which I get when I see my patients, seeing the joy on their face, when they say, "Oh, Sahib, is that you? We've never seen you before. We've seen you in pictures, but we've never seen you because you're always in that outfit." So it's a great feeling. And COVID is a pandemic, is a war. We're all working on the front lines. It's been now 3.5 months. But we're getting there. We're not losing hope. Patients are getting confident. Doctors at home are getting more confident to treat patients at home. And medicines I don't know patients are getting well because of medicines or in spite of medicines. But everything is helping out. We had a strategy to divide the hospital into COVID, non-COVID, etc. How to treat the patients where we have still very few of us treating these patients. So we have an understanding, we share information. Then bedside medicine is individual medicine, how you approach the patient, etc. But I'm not one who, when I admit a patient, gives the patient everything. I don't want to give him dexamethasone and remdesivir and favipiravir and itolizumab and everything. There is a place for it. Otherwise, there is no difference between nurse treating a patient and a clinician, because everybody knows the 6 drugs that are available. If you were to give all 6 drugs to all the patients, then what's different? Because remember the golden rule, which people are forgetting. Out of 100 of you, 85 will get well. You'll be asymptomatic and you'll get well. The remaining 10% out of 15 will have mild symptoms, from cough and cold and mild fever to high fever. And from high fever, those 5% will develop breathlessness, chest discomfort, will need oxygen. So that 4-5% needs to come to hospital. And out of that 4-5%, only 2 or 3% will need to go to ICU. So when they get to ICU, remember, getting to ICU and putting on the ventilator is a tough thing. The patients that we have lost, and not many, out of the 300 plus, I must have lost about 5 patients or 6 patients. Those are the ones that we had to put on ventilator in a hurry. Those are the ones where the disease galloped. Either they came late or they had an underlying uncontrolled diabetes, heart, kidney, or other diseases. So in preparation, I keep telling all my patients who are sitting at home happy, polish your diabetes, control your blood pressure. So when and if you get the infection, the virus can't knock on a bad diabetes or a bad blood pressure. It gets your immunity, we'll fight it. So many of my blood pressure and diabetic patients have gone home because so much of India is diabetic and has blood pressure. But a positive attitude also has helped. A smiley patient, by and large, heals better than a grumpy patient. And that is a rule for all medical patients, and definitely in COVID. If you stop eating, if you stop, if you become down in the dumps, and now this damn WhatsApp and social media send so many things. So the patient can come without money in his pocket, but he doesn't forget the charger in his pocket because he wants to charge the phone. And all the time he's on that. And sometimes, or more often than not, the social media can bring you bad news. And that's what depresses the patient. So you must have a positive attitude. Remember, the mortality rate is 2 to 3%. You're going to live. You're going to do it. So do it properly. We didn't get so scared from the Chinese experience as we got scared from the Italians and definitely the US.
Yes.
When we saw on CNN and Fox News that Central Park is converted into tent hospitals and people are dying like nine pins, there was a wave of fear and panic. People had corona, for them was a death knell. Yamdut, as they say, humko saab wo Yamdut nahi aana chahiye. But Indians have used their ability to master illness because of their immunity. We have had common colds, we have had H1N1, we've had pollution bronchitis, we've had, like I said, amoebiasis, we've weathered tuberculosis. So many people in this country around you have tuberculosis, but not everybody gets it. So that has helped our patients with their innate immunity, whether it's their MMR or BCG or whatever. Our death figures are not so bad. Our patients are also happy to use medicines. We have got adequate stock of medicines. Our doctors were well prepared. We looked at the experiences of the Italians and the Americans and the divine hand of God. God has been kind. We have numbers because we have a population. We cannot social distance because we live cheek by jowl. But having said that, we are still done quite well. And finally, we will see that nature will dilute this virus, will weaken the virus, will attenuate the virus, and we'll be able to overcome it. We'll have to learn to live with the virus. I mean, a lot of people say that when the vaccine comes, we'll be free. Aap vaccine ka mat socho. It's like chasing the pot at the end of the rainbow. Think of today. My appeal to everybody is, don't forget your civic rules. Your mask, your social distancing, your reticence to go out and crowd. So what if the shutters of the wine shop are going down? Think of your health. And the young people, I want to tell them, it's not you yourself. You're being selfish. You go back home to your aged parents or your grandparents. Think of them. They don't have the same immunity that you have. And therefore, follow civil obedience and stick to the rules. Because, the enemy hai, you can't see him, you can't smell him, you can't touch him, you can't feel him. So at least you can hide from him. So my experience is, if we are able to follow all these social disciplines, gradually, it's been 4 months almost, but more and more people are getting exposed, but more and more people are staying at home. More and more people are recovering. And the antibody tests are now telling you, I have phone calls from people, sir, mera antibody positive aa gaya. हमको तो कुछ हुआ नहीं था, फीवर नहीं हुआ था. Then I say, क्या आपको फीवर होना जरूरी था? आपको फीवर चाहिए था? आपको asymptomatic अच्छा हो गया. You have a passport. Why are you worried? I think people should take this in their stride, look at the good news which is happening, and don't read the downtrodden bad news which gets to 2 out of 100 people. Be optimistic. Definitely the drugs have lent support. When you give steroids, you reduce the cough, the swelling, and the inflammation, which is mandatory. In those 4-5% of people, if you give steroids, it helps to prevent the inflammation. When you give blood thinners, you prevent the complications, heart attacks, embolization, other things. If you give favipiravir early, you can treat the mild ones quickly. If you give remdesivir on time, you can help the recovery. So everything has helped. And with every new thing coming, the mortality rate has to come down. You cannot keep the infection away until you have a vaccine. The only way until then is to keep yourself protected. But with the help of these drugs, when you get the infection, your infection recovery time is shorter, quicker, and definitely more success to it. That I will say. drugs have added their bit. There is no antiviral drug. जैसे मलेरिया में है, गोली खाओ आपका malarial parasite मर जाएगा. I don't have an anti-corona pill. So we have supportive pillars of treatment which are antiviral, anti-blood thinning, anti-inflammation, all put together. But that doesn't mean patients should take everything of everything. Remember, this is the other thing I've seen. I'm seeing, sir, I've taken favipiravir, I take 2 vitamin C's, I take 2 zincs. You don't have to overdo it. Just because sanitization is good doesn't mean you wash your hands 45 times with alcohol and you drink also alcohol thinking you'll sanitize your insides. You have to do everything under supervision, especially when it comes to taking drugs. Viral bimari mein only vaccine has helped. आज चिकन पॉक्स, स्मॉल पॉक्स, मम्स, मीजल्स, ये सब कैसे चले गया? वैक्सीन. बट द एफिकेसी ऑफ द वैक्सीन नीड्स टू बी सीन. कितना पावरफुल है, कितना एंटीबॉडीज बनाएगा, whether this vaccine will work and give you immunity for long periods of time. All this needs to be seen. आप एक पूरा मिर्ची सारा एक आदमी खा लेगा तो he will have indigestion. बट ये मिर्ची को आप क्रश करके कम्युनिटी में डिस्ट्रीब्यूट करेंगे तो ओवर अ पीरियड ऑफ टाइम there will be herd immunity. And herd immunity, when that happens, the virus replication makes the virus weaker. Attenuates. Attenuation yani weak banana. The virus attenuates. As more and more people get infected, then the virus selection to pass on also becomes attenuated. So this is the khwahish that we have. This is the dream that we have. H1N1 का वैक्सीन कहाँ गया? आया ही नहीं. मगर H1N1 कहाँ गया? वो तो चले गया ना. तो same way, the heart, the human race is not going to die because of corona. We are here programmed to defeat it. And we have, you can see what's happened in the West. See what's happened in China, Taiwan, Japan, in the West where things are opened out. You will have to learn to live with it a little bit. And even literature and science, when they say that a patient who became negative is again tested positive, I would say let's do the test again. Quite often the dead fragments of the virus sitting in the respiratory tree, that could be picked up when the swab is taken. Okay. And the dead fragments will give you a positive RT-PCR. बीमारी बहुत नई है, 6 महीने भी नहीं हुए हैं. आप उसके रूल्स कैसे बना सकते हैं कि वापस आने वाला है? आएगा तो देखेंगे. We are now at the top of science. We have all the facilities. Why should we live in fear? We should live in hope. This is my message. At my age, I'm supposed to sit at home and not see patients. But I'm going every day, including Sunday. But I'm careful. I wear my PPEs. I have so many baths. I live in a separate room in my house. I make all the sacrifices. So God is kind. If you make sacrifices, and if you are optimistic, like I am optimistic, nothing will happen to you. Be careful. Be honest to yourself. वो इंडिया में वो जुगाड़ and चलता है attitude मत करिए. So God made humans as the supreme being over the animals, insects, birds, and everything else. God didn't make us to die. Let's fight corona together. Let's fight it positively, and we'll win. Look at tomorrow. Don't look at yesterday. God bless.
Not only Dr. Hemant Thacker is playing his role in helping people overcome COVID, but he is also providing infinite moral support, and that's a very important element, especially in a pandemic like this one. We need doctors like him not only to overcome this virus, but also to learn how to live life with positivity and happiness. We salute him for his services.